Over 1.8 million Nigerians above the age of 40 suffer from glaucoma, with about 360,000 of them going blind in both eyes. What exactly is glaucoma? What are the symptoms? Is it curable? Well, you'll get answers to all these questions in a while. My name is Oluwatoyin Kolawole and the program is Health Business. Welcome on board.
Pharmacists in Nigeria, most especially community pharmacists, have been charged to be more proactive in their responsibilities and also thrive to be at par with their counterparts in all the parts of the world. The advice was given at this year's Continuing Education Conference, organized by the Community Pharmacists Lagos chapter. While delivering her speech, the keynote speaker, Osariti Jayola, explained that the role of community pharmacists is not just to dispense drugs.
The community pharmacist is a member of a dynamic healthcare treatment team, and they play a key role because they are the closest to the patient. Eventually, because they live in the community, they are able to understand the dynamics and the problems that happen with the people in the community. You can imagine a man who's been blind from glaucoma. He doesn't have anybody to take him to the pharmacy to get his eye drops. The community pharmacist, because he lives in the community, he knows everybody by name. He knows everybody's houses. He can actually deliver those eye drops to the patient.
The chairman of ACPN Lagos, Abiola Paul Ozie, also noted that the economic situation in Nigeria is shrinking pharmaceutical business across the country, adding that by extension, the non-availability and non-affordability of drugs is affecting the health of Nigerians.
Quite a large percentage of drugs we use in Nigeria are imported. We must also realize that we do not have the raw materials to produce most of these drugs locally. And that's the basic challenge we are facing as pharmacists. Ordinarily, some of the people seated here today as community pharmacists should be able to do what we call backward integration, consider setting up local manufacturing outfits here and there, because a local manufacturing outfit will invariably employ more people than a community pharmacy.
With the theme of the conference, Community Pharmacists Healthcare Interventions for National Development, it is believed that with continued training, Nigerian pharmacists be a tool to drive the country's health sector to desired stage. Over 300 residents of Amuwo-Odofin, a suburb of Lagos, have benefited from a medical outreach organized by the Lagos State Nigerian Medical Association to commence their forthcoming conference. The outreach was flagged off by the president of the association, Professor Mike Ogrima, and the state NMA chairman, Olurotimi Odushote. The executives of the association noted that the outreach is to complement government's efforts in ensuring that Lagos residents have access to comprehensive health services.
Doctors in Nigeria, they are known for strikes, right? It's not like that, doctors, love to strike, not at all. But, this program is basically organized just to show the community that we care for them.
Well, it's quite impressive. We've been able to address health conditions for about over 200 inhabitants.
I'm actually impressed too because this place is not densely populated, so we had a fear that people might not turn out enough, but we did a lot of community mobilization, and then we've been seeing a lot of people, and they have been very grateful.
Residents of the community commend the organizers and called on other professional bodies, NGOs, and well-meaning Nigerians to emulate the gesture so as to improve the health conditions of Nigerians.
This is a lovely program. It's nice, and we added a lot of days. I mean, the medical association, they've added a lot of days to our life here today. A lot of our men and women, they are here receiving prompt attention, and they are very happy.
The doctors explained that the gesture will also help to identify other areas of health needs of the citizens to ensure proper intervention from government.
Nice to know you are still watching Health Business. I'm now being joined by a consultant ophthalmologist, Dr. Biola Oyeleye, to discuss glaucoma. You're welcome on the program.
Thank you very much.
So what exactly is glaucoma?
Okay, glaucoma is a name of a certain group of conditions affecting the eye. And what happens there, the pressure in the eye damages the optic nerve, which is the nerve at the back of the eye. Now, the optic nerve is responsible for carrying any information from the eye to the brain. So if the optic nerve or the messenger of the information as it is damaged, then you won't get images getting to the brain as clearly as they should. So in glaucoma, you have damage to the nerve causing problems.
What are the risk factors that can predispose someone to having glaucoma?
First of all, if there is glaucoma in your family, you are more likely to have glaucoma than somebody who doesn't have glaucoma in their family. So if you have glaucoma in your family, you are 4 times more likely than somebody who doesn't have glaucoma in their family. That's what we call the family history. Now, if your eye pressure is high, it does not necessarily mean you have glaucoma. However, the higher the pressure, the more likely you are to get glaucoma. In Africans, glaucoma is more of a challenge than in Caucasians or other races. So being an African is also a risk factor. If you are short-sighted, that means that things nearer to you are easier to see than things further away from you. It also predisposes you to having glaucoma. It does not mean that you will get glaucoma because you are short-sighted, but it makes it more likely that you get glaucoma.
Having known all those facts, what are the symptoms of glaucoma?
Right, there are 2 main types of glaucoma. The type we have in Nigeria or in Africa, more or less, is what we call the open angle or the chronic type of glaucoma. That type of glaucoma doesn't have any symptoms until it's very advanced. And most glaucomas in this part of the world, 99% of them are this group I've told you, the open angle. The closed angle is when you have symptoms. And the closed angle is not common in this part of the country. We do get it, but it's not common. And the symptoms when you have closed angle glaucoma are sudden onset blurry vision, sudden onset eye pain, and if you look towards light, you will see what we call halos. That's rings around the light, colored rings like rainbows around the light. Those are the symptoms of acute glaucoma. But like I said, the common type, open angle or primary open angle or chronic glaucoma, you don't have symptoms until it's very, very advanced. And then you've lost your peripheral vision and you start bumping into things.
Let's now move to the management of glaucoma. What is the treatment plan like?
Right. When we talk about management of glaucoma, one key thing which a lot of times we forget about is education of the individual. The more you understand your condition, the more likely you are to manage it properly. So the first thing I want to say is education. Even if you don't have glaucoma, if you know about the disease and you know there's anybody in your family who has glaucoma, then get your eyes tested regularly. So if you have glaucoma, then you want to know what happens if you don't control your glaucoma, because it will lead to blindness if it's not treated or if it's treated inappropriately. If you know that you're more likely to respond to doing the right things. Now, in terms of modalities of treatment, there are three main types of treatment. Medication, which is usually eye drops, sometimes we give tablets. Laser treatment or surgery.
With your years of experience, will you say glaucoma is curable?
Glaucoma is not curable. However, well managed, we can prevent it from getting worse. So if you've been diagnosed as having glaucoma and you are receiving the appropriate advice and the appropriate treatment, then you could stabilize it and prevent you from getting worse.
Finally, is glaucoma hereditary?
In some situations it is. Like I had mentioned before, if you have it in your family, you are more likely to have it than others who don't have it. Now, there is a group of individuals we say have congenital glaucoma. Congenital glaucoma, that means you are born with glaucoma. You develop within the very early stages of life. And we actually have some children who, within the first 2 or 3 months, we pick them up that they have glaucoma. Those children, usually because the pressure in the eye is large and the eye is still forming, it stretches the eyes. So they have big eyes, look very beautiful, but it's actually the pressure in the eyes causing the problem. And there are other ways we can also use to diagnose them, because sometimes they have a lot of watering of the eyes because of other problems they've had within the process. But I want to stress that because your eyes are watery doesn't mean you have glaucoma. So people shouldn't say, oh, my child is crying all the time or whatever, they have glaucoma. No. If you're concerned there's glaucoma in the family or you're concerned, see your ophthalmologist and let them look at that for you.
Well, it has been so nice sharing all this information with us on Health Business this morning. Thank you so much for coming.
Thank you very much.
Well, that has been Dr. Biola Oyeleye educating us on the dangers and management of glaucoma. Did you know that different technical groups in the pharmaceutical sector? Well, on the pharmacy segment this morning, we'll be taking a look at the role of community pharmacists in Nigeria. Stay tuned.
The pharmacy profession has expanded significantly around the world in terms of professional service delivery, especially in the last 2 decades. It has been recognized as an important profession in the multidisciplinary provision of healthcare because of its current evolution towards clinical orientation, otherwise called pharmaceutical care. Community pharmacy is a branch of this great profession and by the job description, the most accessible healthcare providers to the public because of the proximity of the pharmacies to the community residents. In an interview with Health Business, the national chairman of Community Pharmacists in Nigeria, Albert Alkali, revealed that community pharmacists are underutilized resource in the healthcare delivery chain in Nigeria.
If you have the community pharmacists doing very well, it's the community pharmacists that actually graduate in most cases to manufacturing. So once we have that interaction, once we have that enabling environment, I want to assure you, in the next shortest possible time, within 5 years or so, we should be able to produce close to 60 to 70% of our requirements in this country. It's the enabling environment we want government to take care of.
Alkali noted that community pharmacy in the country have a significant role to play in the effective provision of qualitative healthcare delivery in Nigeria. But the environment they operate in falls below acceptable standards.
We've talked to the federal government to create an enabling environment for the production to be done locally. Now, they can do that by ensuring that there's stability in power supply, by providing the necessary infrastructures for pharmacists to be able to set up a manufacturing outfit to be able to produce most of these antiretroviral drugs locally, and also by ensuring that community pharmacists have access to facilities at one-digit interest rate.
Alkali, however, pointed out that drug misuse in Nigeria has frequently been described as irrational, and the communities are worst hit by it, since dispensing of drugs has been hijacked by non-professionals who have no business in handling medicines.
We need the system to be sanitized. All this will contribute into the encouraging local production and ensuring that we're able to meet the local production of antiretrovirals for HIV/AIDS patients and also the anti-cancer drugs for cancer patients.
The community pharmacists have a responsibility to alter this misconception by offering value-added services that carry professional touch in the day-to-day running of their pharmacies, because they are the closest and also occupy a vital position in the hierarchy of healthcare providers to the public.
Next on our lineup is Understanding Infertility with Dr. Abayomi Ajayi.
Oh yeah, thank you very much. I remember her. Yeah, she already has endometrioma, so that's late stage endometriosis. Okay, fine. This will be done tomorrow, so we'll just see what else we can do for her. Thank you very much. You're welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi, and today we're going to be discussing female infertility. This is responsible for about 50% of the cases of infertility. Usually, women are always held responsible for infertility. Well, of course, if you've been following us, you know that women and men contribute equally to infertility all over the world. Now, what are the causes of female infertility? The commonest cause is when the tube, that is the tube that carries the egg, is blocked. Now, there are other things that can cause the female infertility when hormonal problems. Of course, when a woman is not ovulating, we know that ovulation is the release of the egg, which happens every month. If for any reason, which we're going to take that also in subsequent programs on why a woman will not be ovulating. And then, of course, when the uterus has what we call fibroids or polyps, this also can contribute to female infertility. And the last reason probably is when the cervix, that is the neck of the womb, now has some things in it that is killing sperm. Now, what are the tests that we can do for female infertility? We can do HSD or the X-ray of the tubes and the uterus, which we call a stereosalpingogram. With the X-ray, we call HSD. Or we can also do better still laparoscopy. If you have been listening to us also, just like we discussed at the beginning of this program, laparoscopy is like a surgical procedure where you go through a pinhole just under the navel and you're able to see everything happening in the abdomen. Not only are you able to see, we are also able to treat. So we can take off even endometriosis, we can take off diseased tubes, we can take off almost everything. I'm sure you must be asking me, what can we do to treat female infertility? We can take it from drugs, surgery, and then assisted conception. I always like to think in that logical direction. For drugs, ovulation induction drugs are very good when it comes to ovulation induction in women who are not ovulating regularly. And you have a success rate of between 60 to 75% most of the time using tablets or injectable. Now for surgery, a few years ago, 30 years, 25 years ago, TUBAL surgery was the in thing. But we know that the success rate of TUBAL surgery is very limited, but it's only useful for selected patients, probably after they've done laparoscopy and you've seen that the problem is just something, just a flimsy addition, just holding the tube down. You can try that. You know, but other things have crept into the surgical armamentarium in female infertility, and that is endoscopy. When we talk about endoscopy just means looking inside the body, human body, without really going there. You will discover that many of the topics are interlinked, so we are going to still continue to visit some of these things. Always remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
This is where we draw the curtains on today's episode of Health Business. For advert placements, call the number showing on your screen. My name is Oluwatoyin Kolawole and the program is Health Business. Remember, living healthy is a serious business. Bye for now. Thank you.